Non-traumatic atlantoaxial subluxation is seen in Grisel syndrome. Cervical syringomyelia features include burning sensation in hand, plantar extension, and absent biceps reflex. Giant cell arteritis is a feature of temporal arteritis. A patient of rheumatoid arthritis develops sudden onset quadriparesis. Babinski sign is positive. Increased muscle tone of limbs with exaggerated tendon jerks with worsening of gait. X-ray of cervical area of neck should be done in flexion and extension. Corticospinal tract injury involves positive Babinski sign, difficulty in performing skilled movements of distal upper limb, and absent superficial abdominal reflex. Plantar extension is observed in UMN lesion, while plantar flexion or no response in LMN lesion. Clonus may be present in UMN lesion while it is absent in LMN lesion. A 50-year-old came to emergency department with unilateral headache, diplopia, and difficulty in chewing food. On evaluation, MRI was normal and ESR was persistently raised. Prednisolone 40 to 60 mg per day should be started. A 20-year-old presented with jaundice for 2 weeks. His LFT revealed serum bilirubin 0.9 mg per deciliter, SgO2 by SGPT to be 1250 by 1450 international unit. He was found positive for HBsAg and IgM, anti-HEV antibodies and negative for IgM anti-HBc. The most likely diagnosis is superinfection of hepatitis E virus with chronic hepatitis B virus. A patient with normal hemoglobin suffered from sudden acute massive hemorrhage. He is most likely to show high reticulocyte count, high neutrophil, low PCV, and low mean corpuscle volume. Thrombolytic therapy is given within 12 hours in case of STMI. Ductal ectasia is observed in Marfan syndrome. Delta waves are seen in WPW syndrome. Sulfadoxazone is an alternative for penicillin allergic patient. In the aneurysm of posterior cerebral artery, oculomotor nerve is mostly affected. Significant pericardial effusion on echocardiography is an indication to stop thrombolytic therapy in MI. Acute muscular dystonia can occur due to haloperidol. SIRS diagnostic criteria include fever or hypothermia, tachypnea, tachycardia, leukocytosis, or leukopenia. HRCT is the investigation of choice in a suspected case of bronchiectasis, which presents as productive cough, clubbing, wheezing, and crackles. Antibodies against penicillin found in blood indicated type 2 hypersensitivity. Beta agonists are useful in the treatment of hyperkalemia. IgM anti-HBc is diagnostic of acute hepatitis B infection. Staphylococcus aureus is the most common cause of post-influenza pneumonia. Mid-diastolic, open snap, and loud S1 are heart sounds heard in chronic mitral stenosis. A patient has dyspnea, angina, and syncope. The most likely diagnosis is aortic stenosis. IV artesunate 2.4 mg per kg is recommended for severe malaria. Thank you.